4,000 Queensland health workers are tonight suspended from their jobs for failing to get the COVID vaccination. They'll remain on full pay for now, but must explain why they haven't had the jab and could face the sack.
Queensland's stretched health system today facing a new hurdle. 4,000 staff down after they didn't get vaccinated.
We have a number of staff who will now go through a show cause process.
Around 7,000 staff are yet to get the jab, although 3,000 remain on pre-arranged leave. The vaccinated staff remaining picking up the extra work.
Over 92% have already come forward acknowledging they've been vaccinated.
A hint too that Queensland's home quarantine program will be expanded come November 19 or when we hit 70% double dose. Townhouses likely to be allowed and travellers will be able to transit through Brisbane Airport.
We are finalising that criteria currently. I expect it to be released very shortly.
Paying attention yet? So Queensland Health Minister Yvette has just announced that over 4,000 health workers are going to be laid off, potentially right now suspended with full pay, but we all know where that is headed. And total of 7,000 in all, but they're just counting 3,000 of those because they're already on some prearranged long-term leave of sorts. But we can safely assume that if those extra 3,000 have yet to get the jab as well by now, they're not getting it. So it makes you wonder if pretty much every country agreeing with the idea that we needed to slow the curve in order to avoid overwhelming the healthcare system. That was primarily the unified goal, no matter what country you're in, even though Sweden took a much different approach than almost every other country aside from Japan. Then how can you, when the healthcare workers currently are already overworked and pushed to the limit, forcing many into early retirement and or just to leave the career in all because of just overexhaustion, overwork, you put yourself in a position to actually lay off over 4,000, if not possibly 7,000 healthcare workers. Even though that may only make up about 6% of the total healthcare workers, a small number considering that they're obviously gloating that over 92 to 94% of the healthcare workers have been jabbed, if not single dose, double dose. So they've got a great level of compliance. If the current staff workload or current staff levels are already overtaxed, now you remove thousands of individuals from an already overtaxed situation, putting more on the workload of those left remaining, making it even more unbearable, higher numbers of overcrowded healthcare facilities, people not getting the attention that they need on time, and more healthcare workers feeling the burden or crush of the weight of the heavy workload now being thrust upon them, asked to do more work with less time and or less manpower, being forced in a position where they just may walk off. Kind of creating a situation, creating a problem in order to impose, I would think, their solution and or give reason for even more heavy-handed tactics and or agendas. Again, it just seems more and more like they are creating a problem in order to find a solution that will give them a reason to be so overhanded in their power grab to maintain their power, maintain their financial status and or control over the population. But hey, that's just me. Again, what world though does it make sense for you to lay off so many healthcare workers during a pandemic, if not for that more, I guess you can say, sinister reasoning? And why was it okay for them to work so long in this, 18, 19 months of a pandemic without needing a jab and everything be fine, and all of a sudden they are somehow expendable as if the pandemic were somehow over? Again, go fig. Why not, if this is all about the health of the patients and are following the science, why not just test these healthcare workers multiple times a week? It doesn't have to be every single day, but maybe every couple of days throughout the week to make sure that they test negative before starting their work or work week. And if they test positive, send them home without pay even. But hey, that's just me. But But again, if you like this content, don't forget to subscribe to this channel. Your subscriptions go a long way with allowing me to make new content. And also don't forget to interact on this channel. And I appreciate all of the love I've been getting from my subscribers who have been leaving comments and liking the video to help with the algorithm. So much love to you all. So with that said, again, don't forget to subscribe to this channel, like this video, comment on this video. This is Bruce the Boss, and I'm out. Peace.